Shropshire Disability Network newsletter, issue number 6, November 2010. This is part 3 of the article section of the newsletter. £70 million support for people in their homes after illness or injury. This article has been reprinted from the VCS Assembly News Update on the 19th of October 2010. The web address is www.2shropnet/ATOZOF-MINI-sites/V/voluntary community sector assembly/19 October 2010. Around 35,000 people will benefit from a £70 million cash boost that will enable the NHS to support people back into their homes after a spell in hospital. Health Secretary Andrew Lansley announced re-ablement packages to give people who are leaving hospital after illness or injury help and support for 6 weeks. Through re-ablement, people are helped to settle back into their homes, perhaps by changing their home environment so they can get around better, or providing daily visits and support. It ensures that those in greatest need get help to keep them independent as well for as long as possible. Re-ablement can offer savings to the health and social care system by ensuring that people get access to care that will prevent them from getting into difficulties and having to go back into hospital. The government wants the NHS, councils and local voluntary organisations to work together to ensure that local people get a seamless service after discharge from hospital. The extra funding will be allocated to primary care trusts to be spent this financial year across the health and social care system. PCTs will work closely with hospitals and local authorities in delivering this. It will enable local areas to help thousands of people and ensure services are in place by the time the NHS picks up new responsibilities in April 2011 for patients' first 30 days at home after hospital discharge. The government will publish its vision for adult social care in November, including a renewed focus on joint working with the NHS and the voluntary and community sector. Hundreds of thousands could gain access to Alzheimer treatments. This article has been reprinted from the Alzheimer's Society. The webpage is www.alzheimers.org.uk/site/article.php?news ID = 810. Hundreds of thousands of people with Alzheimer's disease who've been denied medical treatment could soon be given access to life-changing drugs on the NHS. The National Institute for Health and Clinical Excellence, NICE, ruled that the medications, which cost just £2.80 per person per day, are cost-effective and should be available on prescription. The draft decision is a victory for people with Alzheimer's disease and their carers who've campaigned with Alzheimer's Society and other organisations for full access to the drug treatments since they were controversially restricted in 2007. Ruth Sunderland, Interim Chief Executive of Alzheimer's Society, says, "This is a momentous day for thousands of people with Alzheimer's and their carers. These drugs can help people have a better quality of life at all stages of the condition. While they don't work for everyone, small but important benefits can enable many people to recognise their loved ones for longer, play with their grandchildren, or make vital plans for the future. Alzheimer's Society welcomes the draft decision and will now be campaigning for more people to have access to the treatments from today." If the draft decision is upheld, 3 drugs, Aricept, Exelon and Rimonil, would be available on the NHS for people in the early and moderate stages of Alzheimer's disease. These treatments have up until now been restricted to people in the moderate stages. A 4th drug called Ebixa would also be made available to people in the moderate to late stages. Professor Clive Ballard, Alzheimer's Society's Director of Research and leading old age psychiatrist, says, "If this guidance is issued, doctors will no longer have to watch people deteriorate without being able to help them. Being able to prescribe in the best interests of their patient will also be a strong incentive for GPs to diagnose Alzheimer's disease earlier and for doctors to go to their doctor if they're worried about their memory. Early diagnosis and intervention means better choice and control in the support and care available. Anne Johnson, 57, who takes Ruminal to treat her Alzheimer's disease, says, "Ruminal's made a huge difference to my life, and I'm absolutely delighted that now so many other people could benefit too. Without these drugs, I would be a shadow of the person I am today. Before I prescribed them, I knew what I wanted to say, but I couldn't find the right words. I had low self-esteem and used to dread getting lost. It was terrifying. Now I'm able to live life to the full. You can't put a price on that. It's immeasurable." There are 465,000 people with Alzheimer's in the UK, and 62,000 people develop the disease every year. In compiling its latest guidance, NICE used a different model to assess the cost-effectiveness of the drugs and concluded that they can now be shown to offer value for money. NICE is inviting people to comment on the draft decision by the 28th of October, with a second meeting of the appraisal committee taking place on the 25th of November. Migraine. Chronic migraine is a disabling condition which affects an estimated 700,000 people in the UK. Research indicates it's responsible for 49% of the absences from work of non-manual workers and 28% for manual workers. 2,700 people with migraine are on incapacity benefit and are likely to have to undergo new assessments of their capacity to work prior to being transferred to employment and support allowance by 2014. The outlook is not good. Job centres are increasingly refusing to recognise migraine as a valid health condition. The Migraine Trust produces a Working with Migraine pack, which, with a great deal of other information, is available from their website, which is www.migrainetrust.org. Recently, researchers identified more causes and potential cures for migraines. The Journal of the Migraine Trust reports that Botox is the first preventative treatment to receive a specific licence from the Medicines and Healthcare Products Regulatory Agency, MHRA, in the UK for patients with chronic migraine. Botox treatments for chronic migraine involves a series of injections into specific head and neck muscles. The BBC reported on the 27th of September that migraine cause identified as genetic defect. This can be found at the following web address: www.bbc.co.uk/news/health-11408113. Scientists have identified a genetic defect linked to migraines which could provide a target for new treatments. A flawed gene found in a family of migraine sufferers could help trigger the severe headaches, a study in Nature Medicine suggests. In this study, scientists, including some from the Medical Research Council's Functional Genomics Unit at the University of Oxford, found that a gene known as TRESK was directly attributable as a cause of migraine in some patients. The study found that if the gene does not work properly, environmental factors can more easily trigger pain centres in the brain and cause a severe headache. Dr. Arno Palotti from the Wellcome Trust Sanger Institute said the breakthrough could eventually lead to new drugs which could switch off the pain of migraines. It opens new avenues for planning new research which possibly could then lead to new treatments. But of course, it's a long road. Dr. Kader, one of the MRC researchers involved in the study, told the BBC's Today programme that research showed the defective gene in migraine patients was underactive, therefore causing the headaches. So what we want to do is find a drug that will activate the gene, he said. Professor Peter Goadsby, trustee of the Migraine Trust, said the identification of a mutation in a gene for the potassium channel in a family with migraine with aura provides both a further important part of the puzzle in understanding the biology of migraine and a novel direction to consider new therapies in this very disabling condition. Health News NHS Choices reports the following, and this can be found at this webpage: www.nhs.uk/news/2010/09 September/pages/high-dose-aspirin-headache-migraine. A jab made from liquid aspirin could be a powerful new treatment in migraine, reported the Daily Mail. According to the newspaper, researchers found that injections containing 1 gram of aspirin reduce pain in people hospitalised for headache. This study reported the experience of researchers from a specialist neurological hospital where intravenous IV injection of aspirin was used to treat 168 people who were admitted with severe daily headaches. Most of these people's headaches appeared to be related to overuse of other types of pain relief medication. Treatment with IV aspirin was reported to reduce pain by those patients who kept a pain diary. Although the study did not formally compare these patients to people who were not receiving the IV treatment. Also, only half of the patients in the study kept a written pain diary, which prevents firm conclusions about the effectiveness of IV aspirin. The study was carried out by researchers from the National Hospital of Neurology and Neurosurgery in London and the University of California. No specific sources of funding for the study were reported. The Daily Mail's headline was "Aspirin Jab Could Beat Your Migraine Misery." It implies that intravenous aspirin could be used for all migraines. However, the study only looked at treatment for headaches that were severe enough to require hospitalisation.